Thanks so much, and I'm really happy that you all can join. Thank and appreciate Anne-Marie Charles, who's just passed the baton to James Nolan, who I'm going to introduce in a second. So we've been doing this together, and we're in our second cohort of students. We just had our second summer. We had 3 our first summer and 2 this past summer. The purpose of the what we call the ESP, Environmental Scholars Program, or ESPERS for short, is to inspire and guide health professional students at UCSF who might someday want to focus their medical or research careers on environmental or occupational or both scholarship and practice. So we have a summer experience that follows for medical students the first year, because essentially that's really all the time they have as a block to do a summer project. It is modeled after an occupational health internship program that I've been running for almost 20 years. That's funded by the CDC and has been really successful. And it's really based on working out in the field with community-based organizations to really understand the perspective of the community who are most impacted by environmental hazards. So we had 2 fabulous students this summer who I'll introduce in a second. Before I do, James, do you want to say anything?
Sure, I'd love to. Hi all, I'm James Rocher Nolan. I'm fresh to the EaRTH Center as interim community engagement manager. Just a couple weeks in, but I've had the privilege of collaborating with lots of folks on the team, and I'm really looking forward to continuing that collaboration, strengthening it, and going even further. So really happy to be here.
Thanks, James. So we're going to have Hannah followed by Valerie, and I think each of them will probably have 10 to 15 minutes, and then I think we'll just have you each go one after the, well, no, actually, let's take questions in between, because if we have Hannah, then Valerie, nobody will likely remember Hannah, and they'll just ask Valerie questions. So let's take a break between these 2 presentations, because I think we'll have plenty of time. And then at the end, James, I'm going to toss it back to you and see if you want to say anything about your work with the EaRTH Center or PACU, or make some comments about the 2 presentations. And then we'll open it up to everybody. Hannah is a medical student in the UCSF Joint Medical Program, the JMP program, and a UCSF PRIME-US scholar. She grew up in San Diego and graduated from UCLA with a degree in human biology and society with a concentration in medicine and public health. So take it away, Hannah.
Hi, everyone. I'm just going to share my screen and then I'll get started. Can everyone see this all right? Okay, so hi, everyone. Again, my name is Hannah El-Sabrout. I, she, her pronouns, and I am a second-year medical student at the JMP. So today I'll be talking about the project that I worked on this summer. And so I was placed at the Western States Pediatric Environmental Health Specialty Unit, also known as the Western States PACU. And this organization was created in 2015, and it's a part of a much larger network of other PACUs as well across North America. And so this is just the one for the Western states, but there are others as well. And this organization aims to provide patient and provider resources that essentially help educate both clinicians and patients about environment and also how the environmental toxins and pollutants can affect pediatric health, and then also the health of pregnant people as well. And they do this by providing a variety of resources. Some are more text-based and some are video-based, as well as some continuing education materials for providers as well. And these wonderful materials are all available on the website, which I provided the link below, if anyone is not familiar with it and wants to explore more. And so my project specifically had 2 separate components. And so the title was Children's Health and the Environment, Educational Tools for Clinical Settings and High School Climate Justice Curriculum Development, which is a little bit of a mouthful, but I'll break it down into two separate components.
Yeah, Hannah, I was
so
going to interrupt you for a second. If you're advancing your slides, we're not seeing them.
Oh, okay. Let me try to reshare then. Sorry about that. Okay, perfect. So this is a slide that I just went over if it wasn't showing earlier about the PACU. And so again, a really great organization that provides resources for patients and providers about environmental toxins and exposures and pediatric and reproductive health. And then my project specifically had two components. So the first one was working on the Pediatric Environmental Health Toolkit, also created by the PACU, and then a curriculum development component. And so for the first component, the PHT, I assisted with developing prescriptions for prevention. So these are essentially, the idea is that a provider can look up a certain exposure and then be able to print out or provide their patient with a fact sheet about it that is essentially a prescription for prevention rather than a prescription for a medication per se. And so these prescriptions will be integrated into an updated version of the PHT on the PACU's website. And also kind of in this component of the project as well, the team and I were working with local physicians. So just discussing environmental concerns that affect the patients and also how to best provide these resources for the patients as well. And then the second component was developing a participatory project-based environmental climate justice curriculum for high school students. And so along with James, who introduced himself earlier, and another medical student, we co-led a team of undergraduates to develop essentially a curriculum that could teach high schoolers both about climate change, but also climate health justice in a way that is engaging. So through a lot of projects and that they would find easily digestible, but also be engaging throughout the curriculum. And so specifically how we did this for the PHT, we created prescriptions for prevention for nitrate exposure in water, human milk exposures, and then PBDEs as well. And then after creating these prescriptions, we also worked on creating a database of local providers and clinic managers who we could then share this information to. And so we emailed those contacts and also included other PACU materials like the Story of Health, which I'll touch on a little bit more later, as well as some of the written articles and video trainings and fact sheets that are available on the website as well. And then for the curriculum component, utilized the AOP's Pediatric Environmental Health book that I provided the image of here, also known as the Green Book. This book provided us with a lot of information about all of the various exposures. And so I use this a lot, both to educate myself about the different exposures, but also as inspiration and source material for creating presentations to the undergraduates about climate health. And so breaking that down into like climate change and climate change science, as well as the different exposures and how those affect children's health and the health of pregnant people in different locations, and how those exposures can vary significantly from being in the home to being in the workplace, and how different considerations to keep in mind when thinking about location. And then after kind of presenting a lot of this information to the undergraduates so that they were on board with understanding all these different exposures and the science behind climate change, then helped facilitate curriculum development. So helping them with creating lesson plans and teaching them to one another and fine-tuning them to make sure that when this curriculum gets taught to high school students, that it'll be both understandable, but again, engaging as well. And so some of the highlights, I was really excited about being a part of this project because I am very passionate about preventative medicine, education, and working with children and young adults. And so I felt like this project perfectly melded together all of my passions. And so these are some of the highlights that came out of this project. So on the left here is one of the prescriptions for prevention. And this is a draft that hasn't been modified aesthetically in the way that it would be presented to patients. So it's more just the content, but some facts about nitrates and the source of nitrates if patients weren't familiar with it and were curious, and then some information on what they should try to do and try to avoid to limit their exposure to nitrates as much as possible. And then on the right-hand side are some screenshots of slides from the presentations that I presented to the undergraduates about indoor pollution, and there were also outdoor pollution presentations, and then also climate change, and trying to look to the future. What are some potential strategies for improving climate change and things that they can do, and also encourage politicians or more structurally how they can encourage change in that way as well. And then some challenges. There were a lot of challenges, but I think we worked together to overcome them. So I grouped them into two different categories. So logistical challenges and then some of the more technical challenges. So this project involved being on Zoom from about 10 in the morning to 3 and sometimes even after that. So I think for the undergraduates, sometimes it was very challenging to maintain engagement and camera on, as I'm sure you're all familiar with, and things like that. So it was a little difficult at times to maintain enthusiasm and engagement, but overall, I think the undergraduates found it very beneficial, and we were able to try to keep it fun and engaging throughout. And then also finding ways to meaningfully engage with the clinics. I think healthcare at the moment, and always, to be honest, is very flooded with just things that need to be done, and there's a lot to do. And so I think engaging with the clinics and finding a way to provide the information, but not necessarily take away time that they need to use for caring for patients. And so we opted for more email-based communication rather than setting up Zoom meetings and things like that to ensure that we could provide the information, but not disrupt their daily workflow as well. And then personally, learning about all the various environmental health exposures, I had heard of many of them before, but I think learning about the pathophysiology of how they affect health was very new to me. So learning all of that over the summer and then learning it well enough to then teach it to the undergraduates and make it more easily digestible was definitely a challenge, but I learned a lot from the process, and also a lot about these various exposures. And then some of the more technical challenges. So in talking about how to potentially disseminate health education materials, we were thinking of different ways and different modalities to potentially do that. So kind of using website-based sources like the PHT, Prescriptions for Prevention, but also potentially using electronic medical records and the dot phrases that can be built into them to then allow providers to essentially type in a dot phrase and then have that information attached to their patients after visit summaries. And then lastly, kind of more direct outreach, which is what we primarily focused on this summer, to clinics, just providing information about these various resources. But hopefully going forward, we'll try to incorporate some more electronic medical records, and also additionally building up some more of the prescriptions for prevention as well. And then community value. So again, I split them up based on the different components of the project. So for the PHT, in being able to kind of provide all of these materials and the different fact sheets and the story of health and things like that to clinics, allowing them to then educate clinicians and also patients about all of these different exposures in a way that is most digestible and appropriate for those different settings. So pediatrics versus reproductive health and things like that. I think the prescriptions for prevention have a huge potential to be very educational for patients and easy for providers to provide to their patients as well. And then for the curriculum, both in allowing the undergraduates to learn about curricular development and how to create lesson plans, also kind of encouraging them and mentoring them if they were interested in pursuing health and medical fields. A lot of them were either interested in becoming doctors or potentially public health, nursing, things like that. So being able to provide them with some mentorship and a better understanding of what it's like to be in medical school and to be in medicine, I think also was very impactful to them as well. And then more specifically, the curriculum that the undergraduates and worked on this summer could potentially be used to help educate high school students about environmental health and climate justice, which has huge impact since high school students are the future, and educating them about these topics is really important. And also there's research about climate climate health and climate change anxiety. And so this could also be used to kind of help inform and allow them to know what they can do to help assist in the fight against climate change as well. And then personally, this project had a lot of value to me. Again, earlier I mentioned I was really passionate about being a part of this project, and also just learning about all of the different exposures in and outside of the home, I think is both really helpful for me and providing this information to friends and family, but also potentially patients in the future, as well as learning about all the different tools that can potentially be used to assist with that education process. So on the bottom, I provided some of these, which I've actually shared with friends and family, as well as some of my classmates when talking about environmental health exposures. So on the left is a screenshot from Purple Air. And so this shows the air quality index in these various parts of San Francisco. And then on the top is a resource called Mother to Baby, which provides a lot of information about various exposures and how they can affect pregnant people and their children. And then on the bottom is a screenshot from the PHT, which I'll talk about a little more on the next slide. And then on the right-hand side is the EWG's water database. So I use this to kind of look up what the water that I'm drinking, what contaminants are in it. And I think it's really empowering to be able to know what's in the water and also how to potentially limit my exposure to those as well. And I think these are resources that could all easily be shared with patients as well as friends and family as well. So having kind of this database for myself of what are the various resources that are available for patients, I think will be really invaluable going forward. And these are some other resources that I wanted to highlight. So the Story of Health on the WSPCU's website essentially uses a lot of stories and narrative to portray some of the risk factors, so environmental toxins and things like that that can affect patients and their families. And I think using narrative is a really effective way to portray these things, and I think very powerful to listen to. And so I really love this resource, and I think it's very helpful. And then on the right, of course, is the PHT. So this is kind of a picture of the overview, and then can go more looking into the various environmental hazards, anticipatory guidance, or key concepts. And I think this is also an invaluable resource that I've become very familiar with over the summer. And lastly, I just wanted to thank and acknowledge some people. So James, who was a huge mentor to me this summer, as well as Dr. Miller and Dr. Holm, who are assisting with this project and the prescriptions for prevention. And then also Anne-Marie Charlesworth, who I'd worked with prior to this project, but who also assisted me with the Environmental Scholars Program transition, Dr. Harrison, of course, and then also Zoe Gilbard, who is a medical student at Tufts University, who is also assisting with this work. So yeah, that's my presentation. Thank you, everyone. And if there are any questions, I'd love to answer them.
Yeah, thanks, Hannah. That was great. I at least have one question, but before I open my mouth, questions from the audience. No. See if anybody has their hands raised. I don't see any hands raised, so just feel free to say or pop in with a question if you have one. So Hannah, I guess I'll ask you, how did you or the PACU find or locate the clinics and undergraduate students?
Yeah, so the undergraduate students specifically, I was not a part of. James was in charge of the recruitment and onboarding for those students. But for the clinics, I had previously worked on a project with Anne-Marie and Dr. Zotnik and another medical student at UCSF, and we created a database that we got from like the clinic coordinators would then pass us on to other people who would be able to assist. And so I used some of the contacts from that resource, that database, and then James and Dr. Holm also had their own database. And so we kind of merged those together and adjusted any of the contacts that were duplicates or inaccurate information, and kind of went from there, and some Googling as well. But yeah.
Tracy has a question, but James, who were the undergraduates, or how did you locate them? What was the audience there?
That's an excellent question. I don't know if they paid you to ask it. We got the undergraduates via Anne Marie, my predecessor, who did amazing work connecting us with a preceptor at Cal State University East Bay, one of the most diverse public universities in the nation. And then he helped facilitate getting this cohort like as a class for class credit. And then from them, I interviewed 20 or so and narrowed down to our selection of 4.
Got it. Tracy asked Johanna, do you know what areas of California have high nitrates in water?
Yeah, so to my understanding, it's generally locations who are closer to farm areas, since nitrates are one of the key components of a lot of fertilizers. And so the runoff can go into the water source. And so if people are using tap water, a lot of times it'll be in tap water that's closest to, but since tap water is also travels from long distances as well, it can spread out. I think geographically on a map, I'm not sure where specifically are higher versus lower, but I believe that they are tend to be higher near areas near farmlands.
I'm just guessing that what's in Tracy's head is in terms of reaching healthcare providers with materials that are relevant to their practice, that there might be certain areas of California where they're more likely to pay attention or use the information.
Yeah, definitely. I think nitrates can also, for this is a specific patient population, but in well water as well can be a problem. So again, not super geographic, but for providers who have patients who drink from wells, that could be a potential target of patients to provide this information to as well.
Any other questions for Hannah? Great job. Yay. Round of applause. Okay, Valerie. Valerie's interested in pursuing a primary care specialty and is passionate about environmental health, climate change, housing, and homelessness. All Valerie, really small problems to tackle. Fabulous. Take it away. Yep, we can see your slides.
Perfect. Let me just.
Small, but we need leaders.
Sorry.
It's going to be up to you. I don't think our generation is not going to solve all those problems, Valerie. It's going to be up to you and Hannah.
All right. Well, with that, let's go ahead and dive in to this presentation. Thank you so much for that introduction. So my name is Valerie, and I'm grateful to be able to share some of the experiences that I was lucky enough to have with Bayview Hunters Point Community Advocates over the summer. So Bayview Hunters Point Community Advocates is a grassroots organization that was founded in 1994 by long-term members of the community and is still governed and operated by community members. And the primary focus of their work is threefold: environmental justice, food sovereignty, and community outreach. And they engage in these issues via community organizing, education campaigns, advocacy campaigns, and provision of direct services. One of the projects that I was involved with this summer was the Community Toxic Index. And this is an initiative to comprehensively catalog neighborhood hazardous waste sites requiring environmental agency regulation. So in order to do this, we first had to identify sites around the neighborhood that would need to be assessed. So a fellow co-intern, Alan, and I, he's an undergraduate at Stanford, were able to pull and view various reports that could help us to identify some of the most important sites around the city for which various toxic concerns exist. And so we primarily relied on 2 reports for this. One was the Brownfield report for Bayview Hunters Point, published by the US EPA. And the second was a report called A Toxic Inventory of Bayview Hunters Point, San Francisco. And that was published in 2004 by the Bayview Hunters Point Mothers Environmental Health and Justice Committee. Lots of words there, but essentially these reports, they're beautiful documents that really comprehensively catalog contaminated sites around the city. and was the primary source of information for us. And that was where we pulled very heavily on those addresses from both of those reports. And essentially, our hope is to basically survey all of these sites in order to produce a database that contains detailed information about each site in a format that can be easily maintained and updated over the course of future years and future decades. And so in terms of like the practical steps, the next step in this process was to input all of these addresses into a map, and then these were further uploaded onto GIS. And the green pins represent sites for general concerns surrounding contamination, while the blue pins represent concerns for leaking underground fuel tanks specifically. And as you can see, there's many sites that need to be surveyed, and only a small handful of community members have gone through the requisite training to be able to go to these sites and document everything appropriately. So another task that I completed for the project was to design a logical sequence of routes that the volunteers could potentially follow in order to make their way through the entire neighborhood. And my goal was to move through the neighborhood from north to south, working out from 3rd Street. And basically I listed addresses, I clumped those addresses that were close together that people could walk between. And the idea is to do it in small digestible trips of 1 to 2 hours each. And there's obviously a lot of ongoing work related to this project, but this was my main contribution. The second project that I was a part of was some of the public health outreach work that Bayview Hunters Point regularly engages in. So every Wednesday from 10 to 2, I was able to learn about and assist with COVID-19 vaccine distribution in partnership with Umoja Health. And I'm sure that many of you are familiar with Umoja already, but this is basically an organization that was founded by Dr. Kim Rhodes, whose mission is to provide healthcare access and education in more neglected or inaccessible settings. And some of the sites that we would regularly go to were the Candlestick RV Park, for example, or elderly homes in the neighborhood. And as a part of the team, I was basically able to help patients fill out paperwork, administer some surveys about cancer screenings, and handle all of the documentation regarding the vaccine distribution. And I was able to meet some really remarkable people doing this work and engage with the community, which was amazing. I also just wanted to make a quick note, even though this was a smaller part, that I was occasionally able to accompany a few members, a few of my coworkers, to distribute lunch and dinner to some of our unhoused neighbors. And you can kind of see a picture here on the bottom right of loading up some of the meals. In addition to this, I also designed a small trifold pamphlet with the hope of providing some education around long COVID. And while staffing the tent each week, we were receiving lots of questions around long COVID and a lot of uncertainty around what the symptoms would look like. And it seemed like this would be an appropriate intervention. And I know it can kind of be difficult to visualize, but essentially the image on the right is the inside, image on the left is the outside, and it would just be folded in thirds. So this was one of the smaller projects that I worked on and contributed. And the final project I was involved with over the summer was doing some preliminary work with getting a co-op startup hub going. And essentially this is intended just to provide some mentorship and business development for cooperatives in the community, and they're meant to be public serving enterprises. And one of the central pillars of the program is the development of a speaker series that can lay out some of the principles behind worker-owned enterprise and some of the more complicated logistical aspects of what that might look like. And so I started to reach out to a few of successful co-ops in San Francisco, and I've listed them here, and was basically able to find a contact at each of those sites, and someone who was basically willing to come in and give a short talk on this topic to the community. So I feel very lucky to have been a part of so many interesting projects over the summer. And when I think back on the experience, I think two things really stand out to me. And one is the extent to which I had the opportunity to really learn about a large variety of environmental factors and toxins that can influence health outcomes. And this is particularly valuable because we don't spend a lot of time on this in medical school. And what was particularly enlightening for me was the realization that toxic exposures that are happening right now don't only affect the exposed individual, but the effects can be transmitted across many generations. And I think that's a really key consideration to have in practice. And then another point that stands out to me was how much I was able to learn about strategies for public health related community engagement, especially as it relates to bringing services to more inaccessible areas. So I learned a lot about what goes into the logistics of that, the kinds of relationships that you need, and trying to make care as accessible as possible to people in the community. Of course, there were also some significant challenges with this work. So, for example, the initiative to build a completely community-driven database cataloging sites of toxic exposure is really amazing and inspirational, but it does require extensive training, a really high time commitment from the people who are able to contribute. And then also there is a need to find ways that are effective to keep records so that, you know, all of the information that is cataloged isn't lost, and to try to build some institutional memory around the project in order to keep it going over the course of future years. And I think we spent a lot of time thinking about how can this be sustainable and not overburdening anyone who's involved. I think another major challenge with this work is the challenge of engaging with a marginalized community, especially when you represent an institution that has historically caused a lot of harm. And I think it's important to realize that there can be a wide variety of reactions to public health work in the community, and it's important to be aware of the local history and to just be willing to engage with conversations around mistrust and what is the vaccine and what does it mean, and yeah, just basically engaging with people around any and all of their concerns and being open to that. In terms of community value, I think there's a lot of value that can come out of these projects, and I'm proud to have been able to contribute to some of them. The Toxic Index project will definitely produce an easily updatable community maintained database of all the toxic neighborhood sites. And I think that can be really useful for advocacy purposes that hopefully can, excuse me, aid in securing some funding and enable some cleanup that can also be tracked over time using this very same tool. And then, you know, provision of accessible COVID-19 vaccination and other health information, I think is pretty self-evident in terms of the benefit that we're trying to provide with those, and hopefully can continue to improve over time. And then finally, with the Co-op Startup Hub, we're hoping to empower community members to pursue an interest or a passion via worker-controlled enterprise that has the potential to directly address community needs, is more directly accountable to the community itself, and also has the potential for some financial independence in the community. And then finally, on a personal level for myself, I think this experience really helped to reinforce the concept that health is completely inseparable from the environment. And I had an interest in the intersection of health and environmental issues prior to this internship and coming into this internship, but I think it's given me a lot more direction as I pursue my career and more concrete avenues that I can pursue and contacts in this space. I've been able to meet so many amazing activists and community members who are doing some really incredible things, and I think it's just given me a little bit more footing in order to pursue this interest. The other thing that I've learned is that, you know, distribution of health outcomes in the community is rooted in history, and there are a variety of reasons that we see certain distribution of health outcomes when people come into clinic. And it's important to remember that health and illness are not ahistorical. They always arise from a political context, a social context, an environmental context, and it's really important to keep all of those in mind in practice. And then based on my experiences with Umoja, I also believe that it is possible to offer the best of what Western medicine has to offer, in the way of screenings and vaccinations, while also trying to mitigate the harms that the institution has caused to some of these communities in the past. And then finally, and perhaps most importantly, I learned to never underestimate the value of showing up consistently for the communities that you seek to advocate for, and doing your best to learn and to build trust. So thank you very much.
Thank you. Thank you, Valerie. That was amazing. That was great. Both were great. Yeah, applause, applause, applause. Valerie, any questions? Let me see.
One in the
Elizabeth or
chat.
Liz says green circles. What sort of waste or contaminants would fall under that scope?
In your, you showed green circles that point to locations. Oh, right. That's an excellent question. So, oops, hold on, sorry. I actually did pull up so as a part of that process of actually doing the surveying, we developed a survey. I wasn't as directly involved with that, which is why I didn't show it, but I can also quickly screen share this document so that you all can see more or less what this would involve. So right here, if you guys can all see this, essentially these are the types of concerns that are represented by those green dots. The blue dots specifically represent the leaking fuel tanks. So there's a huge number of those, which is why we decided to encode those separately. But the rest have concerns that are that fall into one of these categories. And people have received training as to they will research the history of the site, basically what kinds of buildings have been there, what kinds of industries have also existed on the site, and that can kind of help to guide what kinds of exposures we should be thinking about in terms of the documentation. Does that more or less answer the question?
Yes. Any other questions for Valerie? I have a question for Valerie and for Hannah both, actually. I was wondering if you could say or name one thing about this past summer that you found within yourself that you needed to rely on as you did this project. What would that be? Hannah?
I think I need a moment to think about that. I'm not sure.
Okay.
Valerie, you have.
Valerie? Okay, I'll give it to Valerie.
Yeah, I think I can try to take this one. For me, it was definitely, I had to draw on a lot of courage, I think, this summer. We were engaging with a lot of really complex and devastating issues for the community. There's a lot of trauma, there's a lot of pain, and there's a lot of mistrust, around broken city promises and the promise of cleanup, and also mistrust in medical institutions due to past harms as well. And I think just coming to terms and reckoning with all those issues, I think on a daily basis really requires you to reflect and to think about your own role in the institution and what you can do to change it, and how you can offer the best of your profession while also curtailing some of the harms. And I think also going out into the community and being willing to talk to people and engage with people and hear out their concerns, I think also requires a bit of courage as well. And so I was lucky to have such an amazing team with me guiding me through that. But yeah, I definitely think that was the case for me.
Yeah, I think this is definitely a tough question, but I think for me, it was leaning on optimism, because I think a lot of times, especially with the undergraduates presenting a lot of kind of discouraging information about climate change and also all these environmental exposures, and how some of these, like once they're in the environment, it's really hard to then remove them from the environment. I think a lot of times I could feel their discouragement, and also in myself feel that discouragement as well. So leaning on optimism, and that even though we're in the situation that we are in now because of decades and centuries of harms to the environment, and also to various communities who've been differentially impacted by industrialization and racism in this country, I think leaning on the optimism that there's still potential for change, and there are a lot of different policies or potential individual actions that we can do, petitioning and raising the voices of different community members to try to improve the situation going forward, rather than focusing on all of the figures and things like that that show that we're in a relatively hopeless position, focusing on more of the positives as well. Yeah.
Well, I hope, Hannah, that you keep that optimism. I certainly have had optimism for a long time, although it's you know, in the face of all these challenges. I really appreciate how hard that is. I'm going to turn it over to James to talk a little bit about the PACU, but before I do, I just wanted to again applaud both of you. I feel like you are the sort of the scouts for the EaRTH Center. Because it's really hard to work with community organizations and organize folks in the community, whether it's undergraduate students who you're trying to inspire or a community organization. And, you know, that you were able to do that and have the courage and the optimism and the resilience to do it, and then to share what you learned with the EaRTH community and the greater UCSF colleagues here. You guys are amazing, did a great job, and the projects will continue. This is not just a one summer deal for the ESP. We hope that you take a kernel of this and that you can use it for research, or you know, parlay that into something over the next couple of years, because we'll continue to work together through the ESP program. So thanks again. I'm going to turn it over to James. You're going to talk a little bit about the PACU in the last 10 minutes.
Yeah, that sounds perfect, and a perfect transition from not just a one summer deal. I really want to focus even more on the awesome work that Hannah helped kind of spearhead and start the foundations for, you know, digging even deeper into that high school curriculum and like environmental justice, climate justice focus. You know, for some of y'all, I feel like that high school focus might seem a little amorphous and like a little out of your wheelhouse, but just like put that in brackets. Because like, you know, back to Hannah's point about, you know, dealing with like burnout and like trying to keep that optimism, you know, like high schoolers are a great way to do that, right? Like they're positive, you know, arguably naive, but positive and enthusiastic, and they've got that extra energy. And it's such a great time to, you know, start working with folks and really get them engaged in these like core concepts, you know, before they get to be old and grumpy and, you know, so on and so forth. So I want to start that as kind of the preface for my little presentation, digging deeper into high school climate justice curriculum. But again, just kind of keep that high school part bracketed because it's super applicable, I think, across the board, right? And it's really interesting to see, you know, folks, you know, engaging in this material in their 20s and 30s that have never heard of it before. So kind of the impetus is to start earlier, start stronger. And Hannah did a really core part of that work from the very beginning. So disclosure of funding, always super important. Thanks so much to ATSDR, CDC, and EaHS now as well for kind of helping support this work. You know, we really wanted to focus on reproductive and child health because those are the core developmental periods when folks are most vulnerable to environmental harms. And also thinking about the ways that those environmental harms can have long-term, potentially permanent impacts, and really bringing in that climate justice focus, right? Thinking about those who are most inequitably impacted in a negative sense also deserve, you know, disproportionately greater support and mentorship and capacity building moving forward. And then kind of our sub-foci, thinking about like wildfires and air pollution, extreme heat as being really pertinent in the California state. So kind of, you know, again, keeping that human health focus, with regards to climate change, centered and thinking about the way that all of these other challenges constellate, but kind of circled in red are the ones that are most pertinent to the project at hand, right? Especially thinking about air pollution, extreme heat, drought, of course, wildfires being a huge one. And then how in the top right, those can compound pre-existing degraded living conditions, even more so affecting those who are already the most impacted, especially in this country, right? Thinking about low-income communities of color, but also keeping that global context in mind too, thinking with the global South, thinking about countries that have been historically colonized and continue to be, colonized in different ways, from today and moving into the future through all sorts of kind of tricky mechanisms. But I'll move on to the next point. There's lots and lots of momentum for this kind of work, right? Climate change is, increasingly something that people are really interested in. Climate justice, less so, right? So I'm trying to recenter that justice aspect. But climate change is becoming part of required high school curriculum in some school districts in California. But there's some really great momentum even in that. So $6 million was just awarded to San Mateo County for climate change and justice more specifically. San Mateo County just being across or south of San Francisco. There's proposed legislation required statewide, and also there's 3 pieces of legislation in New York. So really exciting to see that happening. At the same time, there's lots more money going into climate justice more broadly. Specifically with $54 billion for climate change in California specifically, and the Inflation Reduction Act putting in billions and billions for climate change in general, and also earmarking specific environmental justice money at $60 billion, and remembering that there's a Justice 40 initiative to mandate benefits, including this, but also beyond that to go to environmental justice communities. So the framework for this project, really again thinking about like why target high schoolers, right? Like youth need to know knowledge now, yesterday, to protect themselves from the impacts of environmental health more broadly, but climate change more specifically. Youth need this knowledge to protect future generations, right? By the time you're in high school, a lot of people are at a reproductively viable age, right? So they already need to know, how to protect themselves and also how to protect themselves during pregnancy and if they're thinking about kids. So super vital for that protection of future generations. Thinking about that youth need to know the knowledge, to know what knowledge they need to pursue, right? Like if we can give younger folks more pertinent knowledge that's directly relevant to their lived experience, and also give them the tools to help start addressing those problems, like here and now where they live, that can inspire lots and lots of, new folks to join the fields that we are already in, right? Those STEM fields, those STEAM fields, bringing in more diverse perspectives. And this is something I've seen over the last 6 or 7 years working with high schoolers happen over and over and over again. Lots of students are like, I've never heard of this before. This is awesome. They get really stoked. Then they go to college. They get a little bit, downtrodden with all the overwhelming information. But then getting those like additional degrees, getting into the workforce, starting to be like part of that solution. And of course, then therefore diversifying and magnifying leadership to address climate change. Starting with high schoolers, again, catalyzing folks, giving them the tools, resources, pay, money, right? To become leaders for environmental justice, and then supporting them in their trajectories going towards college, and hopefully entering in the workforce. Long story short, there's lots of other pieces to this that I don't have that much time to get into, but really think about a lot of that foundational learning, all the different parts of that, and then how those contribute to empowerment, but how empowerment's not the end, right? That's the beginning of starting to catalyze actual transformative practice, like changing the whole system to reallocate resources to those most in need, to bring everybody to a point where they can be fruitful members of society, and also supported in the ways that they need to be determined by their own voice, not these external parties, right? So my job is to offer resources and then get the hell out of the way, right? And then continue to support capacity in the long term, getting resources to folks as needed, as requested on their own terms. So starting with high schoolers, getting them catalyzed as leaders for environmental justice, getting them into college, and then having them lead those workshops is that next step, right? Having them become the teachers, having them in the spotlight, giving presentations in their own vocabulary, in their own contexts, focused on their own issues that they think are most pertinent, and then getting those folks to go forward and go do those additional research studies on, things like pesticides or cosmetics or cleaning products or whatever feels most pertinent and important to them. And again, making sure that we're kind of, there to support connecting resources and so on and so forth. So approach, Hannah already talked about this, but it's essentially see one, do one, teach one. Learn by doing. So we worked with the med students, to build their capacity, but then they also started co-supervising and co-teaching the undergrads. Undergrads started practicing pre-made curricula, teaching those to each other. And then in the long term, we want to get those undergrads to start teaching teachers and also teaching high schoolers. So it's this constant kind of building out model. And again, on the side, us with those resources to help kind of support and add, consultation and resources as needed. So the way we did this in the last couple of minutes we have left is really indexing the pre-made stuff, right? Like start with what already exists. There's all sorts of other really great curriculum that's already out there, including stuff coming out of UC Berkeley. And there's really amazing materials at NIEHS, specifically on climate change and human health, which also has a standards alignment guide that helps inform the way we make all these other things make sense in context. We took all of the kind of best of stuff, put it together in a more kind of holistic index of like what is most useful, right? Like what are the prior pieces of knowledge you need to have context for these other more specific things like wildfires, air quality, so on and so forth. And if you think about it, it's almost like a lit review, right? It's like, okay, here's our intro, here's the background stuff you need to do. Here's the different research that students can actually engage in the field, in their own lives. Think about how we concluded again, wrapping up that human health context, and then that call of action and getting to policy. It doesn't matter no matter how hard you try as an individual, right? If you're still swimming upstream, you got to also address those upstream factors. So each of those had really great strengths, and each of them also had weaknesses, right? Very few of them had human health focus, and almost none of them had this holistic climate justice, children's health, reproductive focus. So we made our own. We developed out 14 lessons, especially around environmental justice, extreme heat more specifically, things like redlining, health disparities, Native American wildfire practices, right? Thinking about the wildfires that we have today are part of a history of colonialism that forbade people from managing and coexisting with nature in a holistic way. And thinking about that climate justice policy. Here's how those fit in, but that's just kind of the next step for where we're at now, is like taking those current drafts, redrafting them, refining them, getting more voices to inform them. And then what we'll do this next semester is I've got 5 more undergrads to kind of help refine those. I'm going to be hiring in consultants, high school teachers, and also people from CBOs, grassroots orgs, and then hopefully piloting them with high school students more specifically. And thank you so much for my super quick mini talk. And thanks so much to Hannah. And I'm really looking forward to continuing to collaborate with all the environmental health scholars over this next year. And again, this is like a long-term kind of project. So we're constantly kind of building up and building out.
Thanks so much, James. Any final questions in the last couple of minutes? Before we go, is Anne-Marie still on the call? Do I see her? Anne-Marie, do you want to have the last word? You passed the baton, and I feel like I need to give you the last word because of the great partnership we had in starting this, and you're being so involved in the 2 first cohorts.
Bob, that is very kind of you. Actually, all that I want to say is thank you, and congratulations to Valerie and Hannah. I think you're just amazing and very inspiring. I've learned a lot from you, and I'm so excited that James is in this role to shepherd this along. I thought your presentation was really great, James, just to see where this is headed. And Bob, I think you have the last word because this was your brainchild. You were the one who conceived of this. So thank you for making it happen.
You are welcome, Anne-Marie. Thank you for all the great work that you put in building this and getting it up and running in such a great way. So couldn't have done it without you. All right. Thanks, everybody. Bye.
Thank you, everybody.